skin in internal malignancy. First one is acanthosis nigricans. Don't think that everyone having acanthosis nigricans will have the malignancy. Malignancy associated acanthosis, malignant acanthosis nigricans is rare. There are some features to differentiate malignant from benign. These people with benign acanthosis nigricans, usually obese one with metabolic conditions, they will have this acanthosis nigricans. Acanthosis nigricans means hyperpigmented velvety skin thickening, mainly of the neck. Also they can have flexural areas. But in malignancy, thin people will have the acanthosis nigricans, flexural exacerbations. And also in the mucosal surface, they can have thickening of the mucosal acanthosis nigricans. Those are more suggestive of malignant acanthosis nigricans. Thickening of the palms, it is called tylosis, and with the acanthosis nigricans, they can have skin checks. This is erythema gyratum repens. This is associated with some malignancy, and this erythematous patterned plaques, it's wooden grain pattern. Some woods, when we cut, there are different designs, those type of lesions associated with bronchial, esophageal, breast carcinoma. We can't see those lesions. Yeah, acquired hypertrichosis lanuginosa. I mentioned the vellus hair and terminal hair. Another type of hair is lanugovia. You can see in the term babies. Just after delivery it will fall off. But if it is premature babies, we can see associated lanugo hairs. If it is developed in adult, associated with these lung breast uterine carcinomas. Necrolytic migratory erythema. Around the orificial lesion, there will be keratotic plaque, erosions, and crust formation. It is associated with glucagonoma. Dermatomyositis, one of the connective tissue disease. It also a paraneoplastic manifestation, cutaneous manifestation. If we diagnose dermatomyositis, we need to screen for the age-appropriate malignancies. Ichthyosis, again similar to acanthosis nigricans, there are a lot of patients with ichthyosis. Acquired ichthyosis, there are different types of congenital ichthyosis are there. Acquired ichthyosis, these hypothyroidism and HIV, those some benign conditions, and Hodgkin's lymphoma, one of the differential diagnoses for this ichthyosis. This is sweet syndrome. Sweet syndrome is acute febrile neutrophilic dermatosis. This is one of the paraneoplastic condition. It's a neutrophilic dermatosis. There are a group of dermatoses. This sweet syndrome, again the pyedoma gangrenosa. These are mimickers of infection. They present with very high fever and high inflammatory markers. Patient will be very ill. Then with the clinical presentation, those who know about these conditions, they will suspect it's associated with not only the malignancy, mainly hematological malignancy, also connective tissue disease also associated with the neutrophilic dermatosis. Here, if we see this type of wound, we will give lot of IV antibiotic and treat. Have to give initially. In spite of those, if it is resistant and persisting like this, we need to suspect pyedoma gangrenosum. There is no infection at all. The treatment is steroid. You have to give high dose steroid. This type of ulcer, having some connective tissue disease features, or elderly one without diabetic, we need to think about whether it is neutrophilic dermatosis. The difference is those who know will suspect early, others takes time. When there's treatment failure only they will think. Endocrinology, there are a lot of cutaneous manifestation diabetic. Big list is there. I have mentioned only few. The necrobiosis lipoidica, yellowish plaque over the shin area. If you carefully look, there will be atrophy and telangiectasia. Telangiectasia means dilatation of blood vessels, these capillaries. And granuloma annulare, earlier I mentioned for the hepatitis B association, here the diabetic. In diabetic, the granuloma annulare usually generalized form. Sometimes, what are the differential diagnoses for this? These days we'll think about tinea, any annular lesion, tinea. The difference is here you don't have much epidermal changes. Epidermis, there won't be any scaling, those features won't be there. And it's non-itchy. Granuloma annulare, most of the times it will disappear spontaneously. If we give some steroid, it will augment the resolution. And diabetic dermopathy, it's a common manifestation of diabetic patient, like cigarette burn mark in the shin areas without any ulceration or anything, just hyperpigmented macules. This is similar to the acquired perforating dermatosis we have seen in renal disease. Other causes diabetic, Kyle's disease. And diabetic bullosis, here the bullous can be very superficial, fragile one, or deep tense blisters also. There is no secondary infection, it will heal spontaneously. If there is a large bullet, we have to just prick and release the fluid and keep the superficial layer for the natural covering. And diabetic cheiroarthropathy, prayer sign, because of this stiffness they will develop this skin. Vitiligo, in type 1 diabetes, when they have autoimmune condition, other autoimmune conditions also can be associated, and vitiligo one of the autoimmune condition. Neuropathic ulcer, because of peripheral neuropathy they will develop this neuropathic ulcer. Very thick hyperkeratotic areas will be there in the surrounding skin. We need to treat offloading and treatment of surrounding keratolytic. We need to give importance for that. Dermatology people will give importance, otherwise other just IND only will not give quick recovery. We need to address the surrounding hyperkeratotic areas and need to give some topical agent to reduce the hyperkeratosis. Importantly, offloading is important. Offloading means need to arrange the proper shoes. Hypothyroidism, one of the cutaneous ichthyosis I have mentioned earlier. I had the pictures, I couldn't put it. Here the carotinemia, yellowish discoloration of skin will be there, not the sclera. That is the difference between this carotinemia and jaundice. And hyperthyroidism, pretibial mixed edema. Hyperthyroid acropathy, they will have this onycholysis and nail damages in thyroid associated conditions. Cushing syndrome, they can have this hypertrichosis and moon face, striae. This is addition disease, hyperpigmentation, mucosal as well as they will have the increased pigmentation in the skin creases. If you see the dorsum of the hand, some other condition also these days they will present like this. Whitening cream usage. And sarcoidosis, there's no specific features. There's no much features. It's a mimicker. And any shape of lesion they can present. One of the causes is erythema nodosum, painful nodular lesion over the shin area. And over the scars, if there's a granulomatous lesion, we need to suspect the scar sarcoidosis. And this is the condition in the nasal alar, the purplish plaque, blue lesions, lupus pernio, and any type of lesions they can present. Connective tissue disease, rheumatoid arthritis, rheumatoid nodules can be seen in elbow region and ear pinnas, and also they can present with vasculitis, with necrotic ulceration in the distal part, and neutrophilic dermatosis I have mentioned. In addition to pyoderma gangrenosum and Sweet syndrome, there are some other like papular lesion, multiple papular lesions, painful papular lesion coming in a rheumatoid arthritis patient. We need to suspect these kind of lesions. Raynaud's phenomenon. When exposed to cold, they will have the whitish, pale, then bluish discoloration, then the hyperemic erythema. It will be there in systemic sclerosis and also SLE and other connective tissue disease, mixed connective tissue disease conditions like that. This is amyloidosis. Amyloidosis, we know the cutaneous amyloidosis is separate, systemic amyloidosis is there. Cutaneous, this is the primary systemic amyloidosis presenting with this type of purpuric lesions around the eye. The pure cutaneous amyloidosis, there are macular amyloidosis and lichen amyloidosis. We are not going to discuss here because it's systemic conditions associated with cutaneous manifestation. What is this? Hyperpigmentation in child with fever. Chikungunya. In adults, they will have thick nose, hyperpigmentation of the nose. In child, they can have the generalized pigmentation also. Chikungunya, this type of skin lesion, they can develop. With time, they will resolve. It takes nearly even 6 months time. It will reduce. Thank you.